Imagine losing up to 20–25% of your body weight with just one injection a week. Sounds unbelievable, right? But a medication called Mounjaro is changing the way doctors treat diabetes and obesity worldwide. But is it really better than Ozempic? And more importantly, is it safe? Let's break down everything you need to know. There are many medications for diabetes and weight loss, but Mounjaro has created enormous excitement among doctors and researchers. Here's why. First, powerful weight loss. Clinical trials show patients losing 15–25% of their body weight, which is comparable to some bariatric surgeries. Second, excellent blood sugar control. For people with type 2 diabetes, it significantly reduces HbA1c levels. Third, appetite control. Many patients report feeling full much earlier and experiencing far fewer cravings. Fourth, metabolic benefits. It improves insulin sensitivity, reduces fat accumulation in the liver, and may help improve cholesterol profiles. And finally, convenience. Just one injection per week. But what truly makes this drug revolutionary is how it works inside the body. Most people have heard of Ozempic, which contains semaglutide. Ozempic works by mimicking a hormone called GLP-1. This hormone helps increase insulin release, slow stomach emptying, reduce appetite. But Mounjaro, whose active ingredient is Tirzepatide, goes a step further. It activates two metabolic hormones instead of one. GLP-1, GIP. This is called dual incretin therapy. Think of it like using two metabolic switches instead of one. The result? Stronger insulin response, better blood sugar control, greater appetite suppression, and significantly more weight loss than Ozempic in many studies. Both Mounjaro and Ozempic are given as subcutaneous injections. They are injected under the skin in areas such as the abdomen, thigh, or upper arm. Treatment usually starts at 2.5 mg once weekly. Then it is gradually increased every few weeks to 5 mg, 7.5 mg, 10 mg, up to 15 mg weekly. Ozempic usually begins at 0.25 mg weekly, then increases to 0.5 mg or 1 mg depending on response. Both drugs are generally used long-term because stopping them often leads to weight regain. The biggest difference? Because Mounjaro targets two metabolic pathways, patients often experience greater weight reduction compared with Ozempic. Early side effects can occur during the first few weeks. Nausea, vomiting, diarrhea, constipation, bloating, reduced appetite. These usually improve with time as your body adjusts. Pairing the medication with clean eating can reduce side effect intensity and enhance results. Consistency is key. One dose a week, steady lifestyle changes, and follow-ups with your clinician. Let's look at what to watch for next. Intermediate side effects. Some people may develop acid reflux fatigue, dizziness. Your healthcare team can help manage these with timing, diet tweaks, and dose adjustments. Late side effects. With long-term use, doctors watch for gallstones, pancreatitis. Rare but serious side effects. Although uncommon, these are important. Severe hypoglycemia, especially with other diabetes drugs. Severe pancreatitis. Possible risk of medullary thyroid cancer in animal studies. Because of this, it is not recommended for people with a family history of thyroid cancer or MEN2 syndrome. Always take it under medical supervision after thorough evaluation of the medical conditions and family history. GLP-1 slows stomach emptying and curbs appetite, easing portion control. GIP alongside GLP-1 can amplify insulin response and improve post-meal blood sugars. Over time, combined signaling may reduce liver fat and help improve cholesterol profiles. Dual incretin therapy means two coordinated pathways working together. For many, that translates to better control and more sustainable weight loss. Medication is momentum. Lifestyle keeps it going. Small, repeatable habits build big results. Let's track progress as doses step up and habits become routine. Week by week, the plan advances. Dose titration, gentle activity, mindful meals. Aim for brisk walking most days. Build stamina safely. Clean eating, protein, fiber, healthy fats, and hydration. Plan your plate before hunger decides for you. Add resistance training 2 to 3 days a week to protect muscle while losing fat. Yoga supports flexibility, posture, and stress relief, all helpful with appetite control. Track inches, energy, and sleep. not just the scale. Enjoyment matters. Dance counts as cardio too. As tolerated, clinicians step from 2.5 milligrams to 5 milligrams, then 7.5 milligrams, then 10 milligrams, up to 15 milligrams weekly when appropriate. Ozempic typically ranges from 0.25 to 1 milligram weekly depending on response. Whatever the plan, consistency and medical guidance are non-negotiable. By weeks 8 to 12, many notice looser clothes and better endurance. Daily tasks become easier, a quiet sign of metabolic change. Lab markers often improve alongside weight, especially HbA1c in type 2 diabetes. Hunger signals shift. Smaller portions feel sufficient. Recovery, sleep, and stress management seal the benefits. 1 injection a week, a simple ritual supporting your routine. Note changes, mood, cravings, digestion, and share them with your doctor. Now, what does the science say when we put Mounjaro head-to-head with Ozempic? The excitement around Mounjaro comes from several landmark studies called the SURPASS Clinical Trial Program. These trials compared Tirzepatide with other diabetes medications. Results showed HbA1c reductions of up to 2.4% and significant weight loss. In another major trial, SURPASS-2 trial, researchers directly compared Mounjaro with Ozempic. The result? Mounjaro produced significantly greater weight loss and better blood sugar reduction. Meanwhile, Ozempic has its own major studies, including the Sustained Clinical Trial Program, which proved the effectiveness of Semaglutide for diabetes and cardiovascular risk reduction. Both medications are extremely effective, but Mounjaro appears to have the edge for weight loss. Both Mounjaro and Ozempic are most effective with regular follow-up, lab monitoring, and dose adjustment. Rotate injection sites to reduce irritation and maintain comfort. If you take other diabetes medications, discuss low blood sugar risk and meal timing. Your baseline health, genetics, and habits all influence outcomes. Use the medical plan as a framework, not a finish line. Diet, exercise, and lifestyle remain the foundation of long-term health. Protect your joints, sleep 7 to 9 hours, manage stress. They all impact weight and glucose. Accountability helps. Find a routine you can actually enjoy. Celebrate non-scale wins, better mood, mobility, confidence. Weight loss is gradual. Sustainable change beats speed. Long-term consistency keeps results from slipping. Now, let's bring it all together. Is Mounjaro the future of weight loss medicine? Possibly. But remember, these medications are powerful metabolic drugs, not magic injections. Diet, exercise, and lifestyle still remain the foundation of long-term health. When the plan is consistent, the results are too. Smarter portions, better habits, sustainable change. Strong evidence supports both Mounjaro and Ozempic, with Mounjaro often leading for weight loss. 1 weekly injection, paired with daily choices, can reshape health. Work with your healthcare provider to tailor the dose, manage side effects, and track progress. Focus on fiber, protein, and hydration. Let the scale be just one data point. Move daily. Even 20-30 minutes makes a difference. Prioritize sleep. It supports appetite regulation and insulin sensitivity. Community and accountability turn intentions into habits. So, is Mounjaro the future of weight loss medicine? Possibly, especially when combined with lifestyle for long-term success. If you found this video helpful, follow Dr. Central for more evidence-based medical explanations. Your journey is personal. Build it with science, habits, and support. This video is educational and not medical advice. Consult your clinician for individualized care.